Hello, I'm Julia Sullivan, the head veterinarian here at the zoo. We've been short-staffed, so we're all very excited to have you come on board as the new vet. Come on in. Let me introduce you to the vet techs here. They're responsible for assisting you with the medical treatment of the animals.
Yes, so if you need anything at all, you can just call on me, or us. Oh, well, we're all very helpful here. Oh, and hi, I'm Nikki.
Nikki here will be by your side when you're treating an animal at the hospital. When you need to be at an enclosure.
That's me. Name's Mike.
And me, I'm Dawn. And as much as I'd like to say I'm chief cook and bottle washer here at the zoo, we can't forget about the animals' keepers.
Oh yeah, they totally know what's happening with their animals. They're the ones who usually bring problems to our attention.
You'll have plenty of time to get to know everyone later on. For now, you might want to head over to your office. I'm sure you're anxious to get started. Be sure to check the map on the wall to see which animals need care. I'll check back with you after each case to review what you've done. Good luck! This is your trophy cabinet. The awards and trophies given to you for a job well done can be found here. This computer will let you research the animals and play games, such as trivia. This map takes you to all the animals in the zoo. Click on the map to treat or visit an animal and to play the tutorial case. I thought I'd give you a few pointers so you'd know how things work around here. First things first, listen to what the keeper says about the animal's condition.
I noticed Gia seemed to be limping around. I think something's wrong with one of her hind feet.
The next thing you'll want to do is ask the keeper questions about the animal. To see a list of questions, click the orange top button. Once the questions appear, select only the ones that would be appropriate for the case. Try selecting the second question. Yeah, no problem. You should ask all questions which are relevant to your case.
Sunshine, summer.
You can find your current score in the top right there, above the PDA.
King.
Now click the Done button in the lower right corner of the screen. After you find out about what's going on with the animal, you'll want to perform a physical examination. All the medical equipment is available in groups at the bottom of the screen. You'll probably want to start with the examine, monitor, and test groups first. To select a group,
Slide.
click on the icon. Remember though, the situation is critical. Start your treatment right away. You can go back and do a full examination once the emergency is under control. In this case, let's
Snow
use the magnifying
frog.
glass from the examiner.
Ed.
You should ask to
Sunshine.
point to the magnifying glass
Summer.
once to pick it up. In the examine group, go to the magnifying glass, which is the first one on the left, and click once on it. Did you notice that rolling over a medical instrument will make its name appear? Its description also appears on the right. Now let's take a closer look at this patient's foot. Click the hind leg section of the animal. Move the magnifying glass over the red area on his left foot. Point to the animal's left foot. See that abscess? Look on the PDA to read about the results of each instrument you use. If what you did was correct, your blood total will increase. Click the button there in the bottom right to return to the previous view of the animal. Click the button in the lower right corner of the screen. Let's try listening to this patient's breathing. Click on the stethoscope to select it. Now select the anterior, or the front of the animal. Use the stethoscope you have and apply it to the chest to check the animal's breathing and pulse. Now you need to determine if the breathing and pulse are normal. Select Normal in the pop-up and click on the check.
Year after year, the people of Zanzibar grew more and more clothes
Good.
for the people of the world.
Keep in mind, if you're ever unsure of what to answer, you can always select the Patient Info button on the PDA. It's the button there with the letter I. You'll be able to read about the species and compare its normal vital signs to that of your patient. Now
He saw
click the button in the
hippos
lower
as
right corner of the screen.
clouds in
Click
the
the button in the
sky,
lower right
daring
corner of
to
the
stand
screen.
in
After
his
performing
way.
the physical exam, you
Clouds
should have a
he
pretty
had
good
to
idea about the
destroy at
animal's
all
condition.
costs.
You can then move on to the treatment phase, where you'll use the maintain, operate, and medicate groups. Surgery can be a little tricky, so maybe we should go over those steps right now. In the operate group, you have everything you'll need for surgery. Let's first clean the area, so select the antiseptic wipe. In the operate group, point to the antiseptic wipe there and click. In the operate group, point to the antiseptic wipe there and click. Now select the hind legs. Now it's time to prep the area with antiseptic. Use the wipe and clean the affected region on the left foot. Good. Now select the scalpel. Good. Now move the scalpel to the top of the abscess and drag downward until an incision the length of the abscess is made. Nice work. See that mass in there? It'll need to be removed. Select the tissue forceps. Now use the forceps to remove the mass in her abscess. Perfect. Better suture the incision to close it up. First select the suture kit at the bottom of the screen. Use the suture by clicking along the edges of the incision to close it. Excellent job. Keep in mind, if you're ever unsure of what to do, select the Hint button on the PDA. It's the green button with the question mark. This will show you what your next step should be. When you reach 900 points, you can be sure you've performed everything you need to for the case. You should sign out. Try it now. Click the orange button with the check mark. What appears is a list of possible diagnoses for your case. Based on what you've done, you should be able to tell which is correct. Your score will reach the maximum 1,000 points if you choose the correct diagnosis. Select the third one in the list and click the check. I'll be here after each case to go over what you've done. And at the end of your time
you add
here,
is fresh
if
milk
you've
and
treated all your
mayonnaise.
patients perfectly, I'll have something special for you. I'm sure you're ready to dive right in. Get to it. Good thing Takashi alerted us to the problem right away. Proper cleaning and antibiotics will make sure she doesn't get a secondary infection. Excellent. Your diagnosis is on the nose. Excellent job of getting the patient's history. This patient was in good hands with you.